The broadcast is now starting. All attendees are in listen-only mode.
All right, hello everyone, and welcome to our webinar this afternoon. We're talking about the continuum of care and veterans integration. So this webinar is kind of targeted towards continuum of care and community members around the new SSVF surge funding that's coming up. So we've got a lot to get through today, so I'm going to go ahead and get right into it. So, okay, it's not. All right, please hold for one moment. Just bear with me for 1 second. We'll get the next slide to advance here. Okay. Okay, so here we are. Apologize for that. So just everyone, so you know, you are muted on this call. Only the presenters will actually be speaking. So we've got there should be a question box at the bottom of your screen. There's a little kind of mock-up on it here. So enter a question at any time. We're going to do questions and answers at the very end. So just know that if you put a question in during a presentation, it will be noted. We're going to have a staff member who is going to sort through them all. We'll try to get to as many of them as we can. So we will also be recording this webinar. So if you have to leave early or if you want to share it with a coworker, it will be up on our website later. So I'm just going to do a quick rundown, and then like I said, we've got a lot to cover, so we'll jump right to it. We're going to kind of cover the progress made so far in ending veterans homelessness, kind of the VA, the Veterans Affairs vision for ending homelessness. Then we're going to go through a good overview of the SSVF NOFA. Then we'll talk about how the COCs are involved in this NOFA process, because it's a little bit different this time, as we'll be finding out, and also how to identify a good provider, because the COCs are going to be asked to sign off on grantee applications for this surge funding. And then we're going to kind of talk about the final push that we're coming up here as we're coming close to 2015 and ending veterans homelessness. And then, like I said earlier, we will have questions and answers at the very end. So on the call today, we've got John Kuhn. He's the National Director for SSVF. We got Vince Kane. He's the Director of the National Center on Homelessness Among Veterans. We also have Steve Berg with us, the Vice President for Programs and Policy here at the Alliance. We've got Norm Suchar, the Director for the Capacity Building Center here at the Alliance as well. We've got Kate. She'll be doing the questions and answers. Kate Seif, she's our Policy Outreach Coordinator. And myself, I'm Ian Listman. I'm Program and Policy Analyst on Veterans Homelessness. So the first speaker is going to be Vince Kane, and I will hand it over to him, and he's going to kind of go over kind of some of the big picture and strategy.
Thanks, Ian. Good afternoon, everybody. It's really a pleasure to join you today, and I'm going to quickly kind of go through sort of where are we and where do we want to be come the end of 2015. I'm certain that many of you on the call are aware of the Federal Strategic Plan and our Secretary's plan to really end veterans homelessness. And what that's meant inside the VA is that since that announcement in 2010, we've been in the process of really trying to transform how we address homelessness, and that we've really kind of transformed our model from one of managing homelessness to one of really ending homelessness. And we've done that by really focusing on sort of data-driven, evidence-based solutions. And so part of that transformation for us has really been moving away from models that were focused on being housing ready or treatment first to models that are now very much focused on housing first, permanent supported housing, and then wrapping the healthcare services around that veteran and family. And most of today's presentation will address those issues, and you'll hear from John Kuhn, my colleague, talking very specifically about one of those key programs that promotes that housing first philosophy, being supportive services for veterans family. So what's the transformation look like? And the slide that up now shows you what kind of progress has been made across the country in reducing veterans' homelessness. And as you can look at the graph, we've made a 24% overall decrease in veterans' homelessness pretty much since the announcement of the federal strategic plan. And those gains are really being seen both in the street homeless population as well as diminishing our dependency on transitional housing. But if you kind of look at that in the red line, there's still opportunities to kind of address that topic a little bit more as we come into the stretch run of the plan. So if we could move to the next slide, what I'd like to show you, and I think this is going to be in part what John is going to be basing a good bit of his conversation with you on today, is that the map will show you that the changes in ending veteran homelessness aren't uniform across the country. And that what you'll see is that we still have some states where homelessness is still a steeper climb than others, most particularly the states in the dark blue. And so one of the things you'll see, and I mentioned this earlier in data-driven solutions, we were really focusing on trying to make sure that we place the resources where the greatest unmet need was, so that resources match needs and that we can then measure progress with a particular focus on a solution that is about permanent housing and then wrapping services around the veteran. So this map kind of gives you an idea of how the progress has been occurring state by state across the country. Where there are still opportunities to really kind of focus ourselves, and John will talk about that in the NOFA, as well as to begin to look at where there are opportunities where there's been great gains, and with just some more concerted effort, we can really help these communities end veterans' homelessness and ensure that no veteran ends up on our streets again. So you can go to the next slide, Ian, that would be terrific. So the next slide, I think, that will come up is one that's going to talk a little bit about supportive services, and John's going to get into that in greater detail. But this initiative has been what I like to call is one of our key game changers. It's focused on permanent housing. It's focused on emerging evidence-based practices around rapid rehousing, and it allows us in the VA to not only care for the veteran, but to also care for the veteran's family. And you can see the type of progress that's really been made in this initiative, which really has been on the streets for the last 3 fiscal years. We have data in this slide for 2 years, and it really shows you the number of veterans that we've helped to maintain in permanent housing, as well as those veterans that we've helped to rapidly rehouse. And that the way we've organized it is that the grant can provide both of those components. Right now, we're more focused on the rapid rehousing, trying to move people off the streets, reconnecting them to permanent housing, and to solutions that really sustain them in that housing. But there is this prevention component as well that allows those at greatest risk to also maintain their housing. It's a grant that lets us care for the whole family, and you can see that in year 1 of our operations, we served about 8,900 children. That's individuals living in the household under the age of 18. Last year, it was closer to 14,300. So this program helps us not only care for the veteran, but for the veteran's entire family. And it's a real game changer for us, and one that we'd like to kind of make sure is more readily available to all our community partners out there. Which brings me to the last kind of statement about sort of where are we, where do we want to go. And I think about it is that really ending veterans' homelessness is truly within reach. The progress that's been made since the announcement and the implementation of the federal strategic plan is remarkable. But we're not there yet. We still have men and women on the streets. We still have capacity building that we need to do, and we still have opportunities to tweak our model to make sure that we're able to sustain the gains that have been made over the last 4 years. And so we think some of the key strategies really are for the federal partners to come together and to support you locally to ensure that the focus remains on permanent housing solutions, that we should be decreasing our dependency on transitional programs, increasing availability of permanent housing, affordable housing, and when needed in programs like BASH, permanent supported housing. We want to incentivize and support local ownerships of the goals, and I think that's, John's going to talk quite a bit more about that. Local coordination so that we minimize the steps or the handoffs from first touch into permanent housing, and that we're using strategies that really are collaborative, that are focused on rapid engagement and minimizing the steps from streets to home. Ultimately, what we're after, and this is something that our secretary says quite a bit, is how do we work faster, smarter, better together? And that SSVF, I think, is the epitome of that motto: faster, smarter, better together. Using evidence-based treatments focused on rapid engagement, connecting to permanent housing, and being done in a collaborative way with communities, where the community is providing the service, VA supporting, but that together we're truly bringing these men and women home. So with that, let me turn this back over to Ian and others to kind of walk us through the nuts and bolts of the presentation.
All right, thank you, Vince. And I'm going to go ahead and hand it on back to John Kuhn, and he's going to go over the SSVF grant in particulars.
Great. You can move it to the next slide, Ian. So I wanted to focus on a couple things that are important to know about the program. First, some of the main concepts is that it's a very focused intervention. When we're talking about doing rapid rehousing and intervening for those who are at imminent risk of homelessness, that's exactly what we're focused on. Their imminent risk of homelessness, resolving their housing crisis if they are homeless, getting them into permanent housing. And this focus means, because it's a very short-term intervention, that we really need to begin with the veteran's strengths and focus in on those things that are important to the veteran. This means assessments that address the barriers to their housing. Income is always going to be an issue, whether that's they need assistance with employment, whether they need help with entitlements and so forth. There may be legal issues, and really the things that have led to their crisis and the things that need to be resolved to get them through their crisis. It doesn't mean that we're going to solve their poverty issues, that we're going to solve all their health or mental health problems. Those issues are often going to be left for a later day and part of the discharge plan, but really here again the focus is on housing. Also important is that SSVF is the only VA service that actually allows you to intervene directly with the entire family. And why is that important? Because if the veteran's family, and by the way, the veteran defines their family, that veteran has a significant other who's not working or is disabled but has no income, obviously getting that significant other income is going to make a tremendous difference to the housing stability of that entire household. So we want to see our grantees intervene with all those family members insofar as that intervention affects what? Housing stability, not lots of ancillary issues that may improve quality of life, really being focused on this key issue. Next slide, please. So one of the things that if you're in the COC that we really look to, and one of the reasons why this Priority 1 exists with the COC endorsement, is the only way these grantees can be successful is to really be linked to a variety of services within their community. None of our grantees can do all the services that are expected to make for housing stability. That the case management, the outreach, the case management, all has to be done linked with other agencies in the CSC, both to provide the services, but also there are veterans who won't qualify for SSVF who need to be linked appropriately with other services in the community. And again, those linkages with the CSC are so important. We would like to see our grantees part of the coordinated entry or coordinated assessment program, and if there is no coordinated entry or assessment program in your COC, that they're at the forefront of helping one get off the ground and develop. We want to see this because this allows the veteran who's being served to get to the right place as quickly as possible, and as Vince described, the sort of the smarter, better, faster process does in fact is facilitated by those coordinated entry systems. So we really do look for that. We look to see that involvement from our grantee within the COC. There's also going to be a strong link to the VA healthcare as well, because VA does a lot of screening and outreach for at-risk status, and we want to see that as part of it. You'll see in the grant application a requirement for those Priority 1 veterans and those Priority 1 Priority 1 applicants are listed in the NOFA, all those COCs are listed, must have endorsements both from the Network Homeless Coordinator and from the COC in part for this facilitation of this outreach. So when we talk about case management, it doesn't mean just case management serving the veteran directly. One of the very important pieces of SSVF with the rapid rehousing, of course, is a relationship with landlords. Since the predominant housing placement for folks served through SSVF is in the private housing, meaning not public, but not in a PHA or other forms of supported housing. We need to have relationships, our grantees need to have relationships with landlords. The landlords are one of their customers. So we're looking to see these grantees have an effective way of engaging landlords in the community, because without those landlords, there essentially is no housing stock. We don't have independent capacity to place into housing. So that's, of course, a big part of it. Then the other parts, you can advance the next slide, that I think people are more familiar with are things like the temporary financial assistance. Temporary financial assistance allows our grantees to provide funding to a variety of providers, such as landlords, utilities, for instance, providing security deposits, moving costs, a variety of things that help our veterans get the services, or I should say get the payments they need so they can get into housing. Those are, again, short-term, very limited. Other important things that we expect to be provided, you can see in the slide, connections to educational and income assistance. VBA is a very important partner for us. For instance, Veterans Benefits, that's VBA, does provide service-connected disability benefits. They provide educational benefits. There's also other things. I'm not going to read them all here, but one I wanted to single out was legal services. We have a variety of challenges that our veterans face that may be they can't get to work because their driver's license is encumbered because of fines, and they need to help getting that cleared up. They can't open up a bank account because they're in arrears on child support, and every time they try to do that, all the money gets taken. They fail background checks because of debts, and as a result, they can't get jobs. So these things are all critical barriers that our grantees need to focus on. Here's just a brief summary of some of the financial assistance that can be provided. Again, you see it's time limited, so those sustainment plans, those barriers have to be addressed, because once those funds are spent for rental assistance, for instance, you only can get 5 months in a 12-month period, there have to be plans so that after that, up to 5 months, and for most it's less than that, and the veteran now has the income that they need to stay in that housing. Next slide. So for this particular NOFA, we have 3 priorities. Priority 1, where there's up to $300 million in the 76 target communities that are listed in the NOFA. That doesn't mean that every target community gets the funds necessarily. They need what I've already described, those support letters, one from the COC, one from the Network Homeless Coordinator. But if they need to meet the at least the minimum point requirements for the grant, which is a 70, I would encourage you folks who are interested in more detailed understanding of the NOFA to go online, and you can get a more detailed webinar describing some of what the scoring is. But those 76 communities have to have that support, and you have to do a complete application and pass threshold to apply for that Priority 1 funding. Priority 2 is for existing grantees, that's renewals, and then Priority 3 is for any money that's not allocated to Priority 1 and 2. What's left over, that's a national competition. Priority 3 would be for new grantees. There are certain restrictions on Priority 2 and 3 that are listed on this slide. There's a maximum grant awards of $2 million. You can only get a certain number of grants. Nationally, none of those caps apply to Priority 1. So anyone who wants to apply for Priority 1 going through the COCs can already have existing grants in their community for up to these amounts and exceed it with Priority 1. Again, no caps to Priority 1. Next slide, please. The use of TSA funds is a reflection of our emphasis on homelessness. So all of our grantees must spend a minimum of 60% of their funds on rapid rehousing. So even though there's a prevention component, which is certainly important, first we have to focus on homelessness, and then we can shift to prevention. So the expectation is all the grantees spend a minimum of 60%. It could be up to 100%, and a maximum of 40% on prevention. The Priority 1 applicants must spend a minimum of 40% of their budget on TFA. And the reason why that is we know that a number of these communities have high rent burdens, and those funds must be available to satisfy some of these demands to get that placement. 50% is the maximum, and the reason why is we want to make sure that there's sufficient case management for those sustainment plans I described, because without the sustainment plans, once placed, somebody is not going to stay in housing. You can see from this slide we've had a lot of success regardless of a veteran's income when they enter SSVF. We have folks with no income, as you can see, getting 80% of them placed through rapid rehousing, and that really speaks to the effectiveness of our case management and the grantees able to deal with those sustainment issues. Next slide, please.
I'm sorry, I just can interrupt real quick.
Sure.
TSA, can you go over some of the acronyms you're using?
Sure, I'm sorry. TFA is Temporary Financial Assistance. The temporary financial assistance are those third-party payments that you saw a few slides ago that allows you to pay rent for a veteran, pay utility assistance for a veteran, child care, transportation, and so forth. And again, I'm really moving through this stuff quickly. I do encourage you, if you want more detail after this, to go on to our website, which I'll give you at the end of this, where you can get a fuller explanation of a lot of things that I'm covering rather quickly here. Here's another slide that describes some of the effect of the sustainment planning and how it increases income. This is the result of our veterans being linked to employment and rapidly linked to benefits assistance. This does not include non-cash benefits, so things like food stamps are not included here. And you can see a significant increase in income for both the rapid rehousing and prevention folks who are participating, and that is what lends itself to sustainment in housing. Next slide, please. Here's a, if you see the black line at 360, that shows after 360 days or 1 year after discharge in rapid rehousing, 90% of all families served and 84% of all singles served still remain in permanent housing. Beyond 1 year, we don't really have much data, but up through a year, so it's a very favorable, sustained housing placement even after the intervention ends. Next slide, please. The challenge in SSVF is not just administering the program, which is certainly complex enough, but being veteran-centric. We want to be sure that veterans are not just told, here's your service if they're coming to an SSVF provider, but that our SSVF grantees are aware of all the services that are available to veterans, both within the COC and within the VA. You really need to be a student of these services in the sense that knowing what's available if you're to truly empower the veteran and let the veteran know what their options are. And this is just a smattering of services that are offered through specialized homeless services within the VA. There's certainly many more in the Continuum. The details on these services can be found on the website listed at the bottom of the slide. But it is important to be able to offer veterans real choice here. And to do that, to offer real choice, you have to know what is available and what's in the community. Next slide. And as promised, here's our website where you can find a variety of training materials, including a webinar. We also have our SSVF University, which describes some best practices that are available in rapid rehousing and in prevention. If you have any questions, please do email us. This is the best way to reach us, so that way we're sure to get the exact contact information and be sure we understand your question. So with that, let me turn it over to Norm. And Norm?
Thanks, John. And let me just remind everyone, if you have a question that you'd like to ask, you can go ahead and enter your question anytime in the question box at the lower right corner. And also just to mention that the recording of the webinar will be posted on our website, as well as all these slides. So if you couldn't scribble everything down fast enough, you'll be able to pull that down from our website. So I'm just going to talk a little bit about the various ways that that continuums of care can coordinate with Veterans Affairs services and providers and such. And there are a few main ways. And one is around the coordinated assessment process. Now, your community is probably in some stage of developing coordinated assessment, either thinking about it, implementing it, evaluating it, making adjustments to it. And the presence of these SSVF resources create a huge opportunity to house many, many veterans, but also a challenge for the coordinated assessment process. Because what you want in a community is to have veterans be able to access assistance no matter where they present or where they meet someone or where they get assessed, that it's not just through VA that they get assistance, but when they come to the coordinated assessment process, the coordinated assessment is aware of the resources available to them and can link them there very quickly. So the goal for veterans, the goal of coordinated assessment is to ensure that they're quickly identified and served by SSVF programs. Now, one of the interesting things about, John talked about how much funding is available for SSVF. This is a very large amount of funding relative to what we're used to in the homeless assistance world. So whereas frequently in homeless assistance, we have to prioritize and triage, this is less a matter of figuring out who to prioritize for SSVF assistance, and more because there's so much assistance out there, it's really more of an issue of making sure that as soon as we can identify a veteran, that we link them to that SSVF program as quickly as possible, almost regardless of their circumstances. Now, there are a couple exceptions, obviously, if they're not eligible for assistance, or maybe they're prioritized for VASH assistance, or for some reason don't want to receive SSVF assistance, then you wouldn't prioritize, you wouldn't link them to an SSVF provider. But otherwise, what some of John's research there that he put up showed, and what other research has shown, is that SSVF is effective for veterans in nearly every circumstance, regardless of income, disability, family status, criminal history, a lot of the things that we normally think of as barriers, SSVF providers have been able to overcome. So when you're thinking about coordinated assessment, I've put up a few do's and do nots to think about. Again, the importance of identifying veterans as early in the process as possible, not waiting to link them to SSVF programs, but trying to do that absolutely as quickly as possible is very critical. As John mentioned there, it's important for the coordinated assessment process to have a basic understanding of the resources that veterans have available to them and under what circumstances they can receive them and when they're appropriate and helpful. And then it's very crucial to have some VA partner in your community or several VA partners involved in the development and planning of coordinated assessment and the evaluation of coordinated assessment. Again, it's so important to get veterans connected with SSVF programs as quickly as possible. Some things to avoid as you're thinking about coordinated assessment, a lot of assessments sort of identify what kind of assistance someone is going to be good for, what kind of assistance matches with their circumstances and such. And I think with SSVF, you have to look at it slightly differently, that there is enough of a resource there to serve nearly every veteran. And so you're not assessing whether veterans are appropriate for SSVF. You're trying to assess whether they're veterans and eligible and linking them as quickly as possible to SSVF. That the success rates have been so high with people in all different kinds of circumstances that you shouldn't be screening people out from SSVF at the coordinated assessment process. And then another challenge we've noticed frequently is that anytime there's an assessment and then a referral to another program, people can get lost in the process. And this is what we found with people who have a lot of barriers, a lot of challenges. Often it's not a matter of the intervention doesn't work for them. It's that they have trouble navigating to the intervention. So ensuring that your coordinated assessment process does not lose track of people that get referred to programs, that the loop is closed, and that the provider of the program that somebody's getting referred to links back to the coordinated assessment process to let them know that the link has been made and they now have they're now providing services to the person. It's very crucial to have a coordinated assessment process that closes the loop like that. So some ways to look at your COC partnering with VA. And so obviously we just talked about the coordinated assessment planning process and carrying out coordinated assessment. But there are several other ways that it's important to integrate VA providers and VA leaders into the continuum of care process. One is around sharing best practices. One of the great things about the SSVF program is it's been teaching people outside of the veterans world a lot about how to do rapid rehousing well and what works in rapid rehousing and for whom it works. And so now we're getting a lot of data. John mentioned the income data, which I think is surprising to a lot of people. And it showed not only that veterans are being housed at good rates, but they're maintaining their housing at good rates, even with no income as well. So there are a lot of best practices that we should be sharing between our worlds. Integrating housing first principles throughout the homelessness system is another crucial area of collaboration. So we normally think of housing first as applying to permanent supportive housing and to rapid rehousing interventions. But what we found is that it's critical to have those principles throughout the entire homelessness system. For example, in the shelter system, what we see that slows down a system from functioning well in a lot of places is that shelters won't refer to a housing first program because they don't think that an individual is appropriate or is ready for that intervention. So even if the provider of rapid rehousing is willing to take people, that they're not getting referred to that place because either shelter providers or somewhere else in the community, they don't have that same housing first philosophy and focus. So having meetings with the various partners and figuring out how to implement housing first principles is another key area of collaboration. And then the last one I want to mention, in a lot of communities, rapid rehousing activities and to some degree permanent supportive housing activities are very coordinated. And in many communities, what they're doing is creating a common landlord outreach process. So maybe one agency will do all the landlord outreach for several rapid rehousing providers. And this can be an extremely effective approach. And it's just important that SSVF providers and other VA-funded services are included in those efforts, that this is an area where we can work together and gain a lot of value by coordinating those services, having common landlord outreach effort, common marketing materials, common memoranda of agreement between different partners, including landlords, policies and procedures for how to do rapid rehousing that we share, sharing case management practices, and having those learning collaboratives or best practice sharing sessions where you can talk about how to effectively do rapid rehousing and share that between the VA and non-VA world. And you'll see on this next slide is some tips for one of the things that COCs are being asked to do, which is to endorse rapid rehousing providers for applying for SSVF. So I just wanted to talk through a few of the areas that we found are very important for success for a rapid rehousing provider. So I think people focus a lot on things like, well, have they had previous experience doing rapid rehousing, which is certainly important, but things that we found are really critical and helpful are the three things listed on this in this slide. One is that do they embrace a housing first approach and philosophy? That carrying out a rapid rehousing program is one thing. Carrying it out very, very well requires sort of an enthusiastic commitment to housing first practices and principles. And Vincent John mentioned using a strengths-based approach. These are important factors in whether an SSVF provider will be successful. So it's important to identify that in providers early on when you're thinking about who to endorse. A willingness to plan and coordinate with the COC, with VA and other homelessness programs. What you want to avoid is the program sort of belonging to a provider. You want these interventions to belong to the community and for the provider to really be willing to coordinate and to work with the rest of the community partners and stakeholders to ensure that the program works well. And then a commitment to house and a belief in being able to house veterans regardless of their barriers. This is related to the housing first approach, but just asking providers, are you willing to serve veterans? Do you believe you can serve veterans well if they have no income, if they have disabilities, if they have poor employment histories, if they have poor credit records? The providers who have that commitment and believe they can do that, that's actually going to have a tangible impact in their outcomes and in their ability to make the SSVF program succeed. So it's helpful to look for those characteristics as you're deciding who to endorse. So hopefully that is some helpful ideas about how to coordinate and collaborate between the COC and VA system and VA providers. So I'm going to now turn things over to Steve to give us some final tips on pushing this through. Steve?
Okay, thanks, Norman. Thanks to everybody else, and thanks to all the people who are listening in on this call. I want to end the sort of formal part of the presentation by pointing out a few things that people listening may have figured out, but I want to just get them out there formally, and really these things are about sort of the historic moment about this. I'll start by saying one of the greatest things about my job is I get to speak for and on behalf of people who have a great reputation for getting things done. That's people who work in the local homeless systems. When we deal with federal agencies, when we deal with Congress, when we deal with policymakers all over, the ability of people who deal with homelessness to do amazing things is something that's becoming much better known and recognized, and that helps a lot. And I think the federal plan to end homelessness, and particularly the veterans part, the idea of ending veterans homelessness by the end of 2015, this would not have been adopted if it wasn't for people's belief that people at the local level could do this. I think what this NOFA, what this SSVF NOFA, combined with the new funding for HUD-VASH, combined with the other funding for VA homeless programs, what this amounts to is really the first time in history that people dealing with homelessness at the local level have been entrusted with the resources to do the whole job for a significant part of the homeless populations in their community. Always before, it's what we've had to say is, we know what to do about homelessness, but we can never get the resources to do it. That, for veterans, for these communities, that day is over, because the money is on the table. The money is on the table, the know-how is on the table through the Alliance, through VA, through technical assistance and training opportunities that are going to be part of this, through calls like this. Now, that's not to say that all the work is done. There are resources that are going to have to come from the local level. Resources like leadership on making this happen. The leadership has got to come locally. It's got to come mainly from the people who are on this call and people from VA who are working on this, people in the nonprofit community, elected leaders. The community-wide enthusiasm to get this job done, I think, that's something that's going to have to come from the local level. The systematic planning to methodically find and identify every homeless veteran and make sure they get the resources they need to be housed. That sort of systemic planning is going to have to come from the local level. And finally, the relationships with landlords, relationships with employers, relationships with other sources of support for veterans like the local veteran service organizations. These are going to have to be generated at the local level as well. Fortunately, what I believe from what we've seen around the country is that these resources are available at the local level, that for the purpose of ending homelessness for veterans, for being able to say to people who put their lives on the line for us that we're not going to tolerate homelessness among veterans anymore, those resources will be available, starting with the leadership from the people on this call. We are confident at the Alliance that the community of people who work on homelessness around the country are going to do something really amazing in the field of veterans homelessness, and we're going to see many of these communities be able to announce that we don't have veterans who are homeless in our community anymore. And that's, I think, the opportunity here, and I think it's the promise here, and it's something that I believe is going to happen over the next 2 years as the work on the federal plan to end veterans homelessness is brought to a climax. So thank you all for being here, and I'll turn it back over to Ian to get us started on the question and answer period.
All right, thank you, Steve. So yes, everyone listening in, go ahead, and type your questions in the box, and we're actually going to have Kate ask the questions to our panel, and we will do our best to answer them. So do we have any questions coming in, Kate?
Yes, we do. So there were actually a few questions around this sort of issue. So we talked a lot about SSVF and who to target it to and everything, but obviously as a lot of communities get to very low veteran numbers, a few people actually asked about, funds, VA funds for prevention. Can anyone just speak to that a little bit about how that would or could or doesn't work?
Sure. This is John Kane. If you look in the NOFA, there is actually a process where we will allow for requests for waivers where you can shift additional funds to prevention. So I described that 60% of all the funds have to be used in temporary financial assistance for rapid rehousing, but in communities that can demonstrate that they have approaching or have a capacity to end homelessness locally and still be, while shifting funds to prevention, you can apply for a waiver, and for those successful grantees, we'll have an opportunity to describe that in more detail.
So you can encourage folks to just go ahead and apply for the waiver, and then those that do will get more details?
No, apply for the grant. If you get the grant, yes.
Yes. Okay. Can you talk a little bit in the sort of same vein, using funds for something else, about diversion? Is diversion an allowable activity under these grants?
Diversion is a tremendous opportunity, I think, for applicants to talk about how they are participating in diversion activities now is also a way of strengthening the application. So for instance, if your agency is at the Acme shelter every morning as part of the screening process to try to divert people from homelessness, you get a letter from the Acme shelter saying you're there every morning or you're involved in their diversion efforts. That's going to be something that's going to really strengthen your application and demonstrate you're involved in the community. Yes, diversion efforts are certainly encouraged.
Two sort of logistical questions. There's been a few coming in. In terms of the endorsement and partnering with the COC, can you clarify who's doing the application, who's doing the endorsing, and if they are one and the same, how does that work?
So we have had questions, what happens when the COC has either a lead agency or the COC itself that's endorsed. That is up to the COC. They can do that. However, they must follow processes that have been established locally for competition. So for instance, if there's HUD competitions that they've all taken part of, there must be a process that organizations can apply and be considered. And it must be a fair process. If there is no such process, even though they get endorsed, the VA may elect not to fund the COC. So the endorsement, again, is not the equivalent of funding. Ultimately, the VA will decide who gets funded or not. We do expect that the COC must have a process that will review applications as they come in. However, who they ultimately endorse is a decision for the COC.
Okay, great. Another sort of logistical question. Can you go over how, John, I think this would also be for you, how the surge funding will be spent year by year? Is it a lump sum, or is it over the course of 3 years, and how that will look for communities?
Right now, what we're suggesting to folks is that they budget it spread over 3 years. However, we certainly are cognizant of the fact that since it is 3-year non-renewable funding, typically what happens in the third year, these projects can wind down as staff leave. So there may be a possibility of having additional funds in year 1 and 2, and somewhat less funds in 3, although we are looking for a 3-year sustained effort. We don't want grants shutting down year 2 or early in year 3. So there has to be sustained effort. But for now, the budgeting should be level budgeting through the 3 years, and then we can have fuller discussions of that as these programs activate.
Okay. Another question. For communities that aren't on the surge funding list, and aren't one of those 76 communities, do you have any recommendations for them on maybe making the most of their dollars or anything along those lines?
So those folks who are not Priority 1, which would be those 76 communities, and are not renewals, which would be the Priority 2, you can apply as a Priority 3 applicant. The Priority 3 applicants that would be part of a national competition, so the funding that is left over will be used for that Priority 3. So you can apply for Priority 3 funding.
Okay. And if you are a Priority 1 76, one of the 76 surge communities, can you apply for your renewal funding and the surge funding?
Yes. In fact, we encourage that. Do keep in mind that Priority 1 funding is not renewable. It's 3 years and ends. So you do not want to give up your renewable funding. There are no restrictions to apply for both Priority 1 and 2. The reason why we are doing the surge funding is to put additional resources in the community. So we don't want communities dropping existing resources or replacing them, because that defeats the whole point of the surge.
Okay, and traditionally SSVF has been really flexible, and communities often use it to cover some costs in BASH, startup costs, security deposit costs, et cetera. Is that still an allowable activity with the surge funding?
Yes, it is. There are constraints on it, though. I would refer anyone who's interested in the program guide. The last 2 pages of the program guide describe some of the requirements for that. We do want to see each of these programs independently lead to permanent housing, although we do recognize that at times it is important for these programs to work together. And again, I direct folks to the program guide, which is online. The last 2 pages describe the appropriate use of those resources.
And if you are one of the 76 communities, how would you have found out about that? Would it just be look at the NOFA? How does that work?
You look at the NOFA. We've had substantial activity, I think, through listservs and emails and other notices through our friends here at NAH, for example, who have been able to alert folks that this announcement exists. So again, the list of those 76 communities are in the NOFA. If you have a question about what 76 communities are, you go on our website, you can click on the application, and you'll see it. It's on the first page of our website. All the application materials, the webinar relating to the NOFA and the training, and the NOFA itself.
And Vince, I'm sorry, I'll move on from John questions in a second. But a question about eligibility. This is obviously a hot topic lately. Veterans who are not VA eligible in the general term that VA uses, are they still eligible for the surge funding?
The same eligibility that applies for any VHA service applies to all funding from the VA. So whether it's surge funding or regular Priority 2 or Priority 3, it doesn't matter how we're sending out the money. It's still VA money. Veterans must be able to be eligible by statutory requirements. Now, that said, one of the reasons why we want such close involvement with the COC, we do expect our grantees to be able to link those veterans not eligible for SSVF services because of VHA eligibility rules, that those veterans are linked to appropriate services in the community.
Great, thanks. And Norm, a question for you. I know you talked a little bit about this, but if you could sort of sum up maybe what you think would be ideal, and John, feel free to add in the letter of recommendation that the COC lead is to write for the grant applicant, what would you recommend they should, focus on, how they should do that evaluation, if you could sort of just summarize a strategy for that?
Sure. Maybe I'll talk about some factors to take into consideration, and maybe John can talk about what is in the actual endorsement letter. But I think, the key factor is that they really are able to use a strengths-based housing first approach to SSVF, that they're not turning away potential beneficiaries because of barriers. Obviously, eligibility is a real barrier, but looking at things like, income or disability or previous employment history or homeless history, we are finding that SSVF and Rapid Rehousing more generally is working across a broad range of populations. And even if you don't have necessarily the same success rate with people who have higher barriers, it's still a much better success rate than the next best intervention they're going to receive. So having that, finding organizations that have that philosophy, that have that approach, and have that commitment to housing first and serving veterans regardless of barriers are really sort of the key factors that you should be looking for. Maybe, John, you can talk about what you're expecting people to say in there as part of an endorsement or anything else.
Sure. The endorsement could be as simple as, we endorse agency X, period, signed by the COC. It can be very simple. However, we certainly encourage a thoughtful approach. We do have an optional, and I want to underline it is optional. If the COCs have a process that they like and have used before, they can use it. But we do have an approach that you can find on our site. It's titled Guide for COCs Endorsing Priority 1 Applicants. I encourage you to look at that on our website, and that could give you an idea of how you might want to approach this.
Okay, great. This is another quick logistical question. So obviously there's a lot of money on the line in these 76 communities, so presumably more than one organization will be interested in applying. And can you just confirm how many people or how many organizations the COC is to endorse?
The COC can endorse up to 2 applications. So there's multiple ways this could happen. So the COC could endorse 2 applications, both at the maximum level funding. Most communities in these 76 target communities are funded for $3 million over 3 years. That means $1 million a year for 3 years at level funding. There are a handful at $6 million. That would be $2 million a year for 3 years, and then there's LA and New York, which are higher levels. So the COC could endorse, say, for those $3 million funded communities, 2 applications, each at $3 million, and then the VA would fund the highest scoring application, one of the 2 applications. Or the COC can choose to, again, the limit is 2 endorsements. Some combination of those 2 applicants will total the $3 million. Or they could choose to elect to endorse only 1 application, and that application is for the full amount. Certainly, we would encourage COCs to look at creative partnerships. As described earlier, we don't expect any one agency to have the capability to do all these kinds of services by themselves. So since many of these communities already have SSVF providers, it may be an opportunity to look at different strengths that different providers have, use them as subcontractors to really develop a very strong proposal where you're using the strengths of each agency in your community who is experienced, or folks who have not provided SSVF services in the past but do have some clear strengths that would benefit the proposal and benefit those veterans that are the target audience.
All right, great. That's very helpful. And Ian, this one is for you. Can you just, before we wrap up here, talk a little bit about the Never Another Homeless Veteran campaign and how it sort of fits into this surge funding and just general efforts over the next 2 years?
Certainly. So there's an ongoing campaign the Alliance has. We've gotten a lot of people to sign on to it. It's an awareness campaign, and there's also steps. So we've got a special website for it. It's www.neveranotherhomelessveteran.org. And on that page, there is a sign-on sheet. So you can click on that, you sign on to the campaign, and then you'll get periodic email updates about what's going on. And we really, this is kind of moving forward. When a lot of this surge funding hits the ground here later in the year, we're going to be offering up challenges to communities to really push them. We've got a lot of communities that look like they might even be able to end veterans homelessness before the 2015 target date. So that's great. So we'll be highlighting some of those communities that are doing good things. There's stuff that individuals can do. So a lot of times people in the communities, just private citizens want to know how they can contribute. So we've got some ideas on there. about what people can do on an individual level as well as on a systemic level. We've got lots of members of Congress, leaders within the administration and former administration, mayors, civic leaders, also other advocates and members of the nonprofit community have already signed off on this. So it's a pretty big deal. And like I said, we've got it's www.neveranotherhomelessveteran.org. You can also find the link if you go to the Alliance website, where you found the link for this webinar. Go on there and you can link through it that way as well. We also have a veterans advocacy if you want to do more boots on the ground advocacy, if you want to advocate to your members of Congress. Also on the state level advocacy as well, we've got a veterans advocacy campaign. You can also find out about that there. And feel free to jump in if I forgot anything about that.
That sounded great. And John, can you just one more time give us the URL for the website to which you've been referring?
Sure. It's www.va.gov/homeless/SSVF.ASP.
Yeah, and I would also, remind folks that if you just Google VA SSVF, it'll be the first hit. So all the resources, there was a lot that was talked about and referred to that lives on that website. Lots of great resources to help people through this application process, which closes, as a reminder to folks,
March 14th. Thank you.
March 14th. So you've got another about 2.5 weeks.
Right, and then March 14th, that has to be received by the VA at March 14th. That is not a postmark date.
Yes, that's important. Similar to COC, NOFAs, it is the date it is due for submission. So with that, I'll wrap up. I would remind everyone that we will be posting a recording of this webinar and the slides on our website, hopefully in the next day or so. Feel free to use it as a resource and send it along to anyone who may be interested. You can also, we had our contact information up a few slides ago. Feel free to get in touch with any of us. I'm sure we would be happy to help you with this process. Ian, anything else to add before we close out?
No, I just want to thank everyone who has served as a panelist on this call. Thanks to Veteran Affairs for their awesome partnership and putting forth these great opportunities. And thanks to all the listeners and your COCs, lead, and other people in the communities who have been listening in on this webinar. This is a huge opportunity. We here at the Alliance are very excited about it, and we really encourage you, even if you're not getting search funding if you're in your community, partnering, your community partnering with the VA is huge, and this is how it's going to make it happen. VA says they can't do it alone. They need a community involvement, and this is really the time where communities and their Veterans Administration or the local Veterans Medical Centers, is the time to really engage them and have that dialogue. And with that, we will end the webinar. Thank you very much. And please feel free to come to the website and get the recording and pass it along to your associates. Thank you, everyone.